Chapter 2, the shoulder, a recurrent dislocation in a patient with traumatic unidirectional instability. This is an examination under anesthesia as part of his surgery. Conflicts of interest: I'm a stockholder with Sonics Health and co-editor of a textbook on musculoskeletal ultrasound. Our subject is a 25-year-old male with multiple and frequent dislocations, the first of which was traumatic. He has no instability in the opposite shoulder, but in the affected shoulder he has a very positive apprehension sign. In addition, he was thin, which makes him a good subject for ultrasound study. On the CAT scan and the three-dimensional reconstruction, we can visualize the bony loss at the anterior inferior glenoid. On the posterior superior humeral head, there is not much of an indentation. Anteriorly, we can see that subscapularis and the biceps are intact. And then we go deeper toward the glenoid, we can see the edge of the bony loss. We can see an abduction external rotation as the head approaches the dislocation position. And then we can see that he very easily slides out of joint without really any effort at all. And he is easily reduced as we bring the arm forward. This is a posterior view of his shoulder. We can see the back of the glenoid with the labrum just to the left and suprascapular vessels just to the right of that posterior glenoid prominence. In the posterior superior head, we can see just a touch of a Hill-Sachs lesion. And this is what a dislocation looks like when it's viewed from behind. You can see the head sort of vanishing. Here we're testing for posterior instability, and there really is none. We did a quick scope before we did the Latarjet to confirm the losses that we saw in the anterior glenoid on CAT scan and ultrasound. Here's the back of the humeral head, and again, there's a minimal Hill-Sachs lesion. So our decision, do we do a capsular repair? And we decided to do this and reinforce it with a Latarjet. The bone loss was not quite so severe, but with his general laxity combined with his history of patellar dislocation, this tipped the scales in favor of the Latarjet. In summary, ultrasound can reveal some bony findings, particularly in thin people, but it is not quite ready to replace MR or CT for labral and glenoid rim pathology, at least not with the current machines. Thank you for watching our video. For more interesting cases, consult our textbook, which is shown in the lower left-hand corner. Thank you again.